There's a research that says that people who have pets in the house are less prone to blood pressure and heart attacks. Today, the quality of upkeep of pets' health is so easy because there's so much available. Yes, it's an expensive hobby. Be ready to invest. It is gonna cost you money. I always say when you buy a Mercedes, you don't ask what the mileage is.
I tell the pet parents that जो पैसा आप vaccination ना करके बचा रहे हो, you'll have to pay 2x, 3x or probably even more.
I think the pets are the best kids to have these days in this very expensive world.
Considering you don't get admissions in Delhi schools any which ways now.
Yes, exactly.
Don't do it as a formality. Do it as your child. I always tell people. We unfortunately live in a system where cars are serviced more regularly than your health or your pet's health.
Hey everyone, I'm Dr. Hansika Singh, a practicing veterinarian in Delhi. This podcast is going to give a lot of insights to the pet parents, be it from grooming point of view or the importance of regular vet visits, when to visit a vet and when you can actually delay the visit. Because most of the panic comes from not having a clear map. So today we have Dr. Narendra Gandhi sir, an experienced veterinarian, and Miss Alankrita, who is a responsible pet parent. So let's get started. Most of the pet parents actually visit the vet after they've got a pet. So it's essential to understand why you should be visiting the vet even before you have actually thought of adopting a pet. Let's understand why it is important to do so.
Well, that's a very good question, Dr. Hansika. It's the most important question actually before you become a first-time pet parent, because you must know what you are enrolling yourself in for. A lot of people don't even understand the concept of the breed, leave alone the temperament, the requirement it takes to feed the dog, to take the dog for exercises, what is the energy level of the dog, is the dog human friendly, what is the purpose of the dog in the house, are you looking at a companion for a single parents who have got one child, or it's just a company for all the people in the house. So these are various factors that you factor in before you adopt a pet. Space is another constraint. A lot of large dogs are up for adoption simply because people don't understand the kind of space they will need, and suddenly they find the dog is destructive in the house. He's dropping things, he's running around, he's a puppy. A dog is a puppy until 2 years of age. So all those things become very important before you adopt. And I hope through this medium we are able to tell people that this is what is required. Otherwise, it's a failure. A lot of people get pet and then they become anti-pet. They don't encourage other people to have pets. They will tell them, oh no, don't get this, use destruction, don't be a pet parent. That's not correct. There is a pet for every family, for every household, for every requirement. And they should come to the doctor or a responsible breeder or a consultant who is able to guide them, which is a best pet for their family size, space, and other things that are involved.
And there are some points that only a vet can inform the pet parent. Like there are certain conditions that a breed is predisposed to.
Yes, absolutely. That's important. Plus, you should also make sure that nobody in the house is allergic to pet dander. Because that's the other thing that crops up. They'll suddenly realize the child is breaking into hives. Somebody has started incessant coughing. They don't know what to do with when these things happen. And then the option is, if they don't find a parent home, they want to either leave them in shelters and put it up for adoption. I'm sorry to say, some of them also leave them on streets, which is not a good thing to do.
So pet parents need to understand that it's a lifelong commitment.
It absolutely is more demanding than bringing up a child.
Yes.
Child will outgrow and he'll be able to look after himself. The pet is looking up to you for everything. So you must know that if you have a small breed, he is going to be around for at least 15 years. So are you ready for that kind of commitment? Good. Another point is, what are the changes expected in the next 10 or 12 or 15 years of your life if you are getting a pet in? Are you looking at a child who will go abroad or outside your house to study? Right. Then that companionship will break. Are you likely to have another childbirth? Or is there something else like a marriage is likely to happen? Somebody will leave the house. So all these things, yes, so these things will happen. And are you in a job which is transferable? So if you have to move cities, is the dog good enough to be moved? I mean, suppose you go from a city which has given you a lot of space to a place like Mumbai or Bangalore. Then do you have enough space for the dog? Which is where we say this is very important to understand the size of the dog that I must adopt. And if I have to travel with the dog, What are the requirements? Will it be easy for me to travel with the dog? That's the most important thing.
So, Miss Alankrita, if you can recall, when you first got your pet Bro, what were the questions that you were keen to ask your vet about him?
Bro came to my life. It was just an instant that it happened. And I had no prior experience of having a pet at my place. Never did I ever wanted to. But suddenly it was just, I saw him and I wanted him. And once I got him, I didn't know how to even feed a dog. The conversation that you guys were holding, I was just wishing that I had this conversation with the vet before I got Dro, that whether he's the fit for my family or not. But any which ways, once I got him, it was about food. What kind of food should I give him? What kind of supplements should I give him? Because he puked after he came. I think in the evening he puked. I didn't know what to do. I panicked. Why is he eating leaves? So there were so many questions that I had, because being a first time pet parent, it was a handful for me. It's like giving a birth to a child, and however for the child you have your nani and the dadi to take care of and let you know how to feed a baby, how to take care of the baby. The baby is crying, what does it mean? But for him, I had no one. So, I had to depend a lot of breeding. And of course, the vet comes so important in your life when you have a pet at your place. So when I went for the first time to the vet, I think I literally took 1 hour of his, or 1.5 hours. And I'm sure once I left, he was like, thank God she left. And till date, it's like that, because, I go by what my vet says. I want to tell all the pet parents that, do not ever falter in vet visits, because you don't know what is happening with your baby. It's always better to go by what your vet is saying, whether it is for a test, whether it's a supplement, whether it's a medicine. Vet is your angel in your pet's life and your life. So please listen to your vets.
Well, I'm glad. I'm so happy. I wish we had more pet parents like you. There's all the advice that we are full of, and half of them don't even wish to listen to us. I'm not complaining, but we have seen this in experience. You say, have you done the vaccines? Oh yeah, my walker does it for him. Then I ask them, and if you have a child, would you let a nanny inject your baby? Kutta hi to hai. That's something that is, it blows my lid off. I can never take that as an answer. It's a full-time commitment. He's a member of your family. My own dog, I don't want to say much about it. I almost flew him out of the country for a surgery, because there are only 2 people in the world who do that. But luckily, I was able to fix it. If I hadn't, I would have actually taken him. He's the baby of the house. Would I not do that for my child? I think we owe it to them. They give us so much in return, unconditional, and they bind us to each other. There's a research that says that people who have pets in the house are less prone to blood pressure and heart attacks. It's just because how they communicate with you, the calm and the peace they bring when you are talking to them, and the way they touch you. There's this latest research I was reading. The pet is sleeping with you in the bed. It's both good for the pet parent and the pet itself. It's amazing. There's so much things are now coming up and their research is not like a reel, flashing on Instagram, then you'll say, oh, somebody said that. No. And today, the quality of upkeep of pets' health is so easy because there's so much available. I have in past lost one of my pet to complication of tick fever, my own pet. I can objectively understand why that happened. But today, there is so much available that you don't let that happen. And of course, the pet parents have to listen to it. Yes, it's an expensive hobby. Be ready to invest. It is going to cost you money. I always say, when you buy a Mercedes, you don't ask what the mileage is.
I'm like, when
So
you have a baby,
to spend that. Exactly. Same thing.
call for it.
Yeah.
So, there are so many reels and everything that flows around that talks about just rub your pet with some neem powder and this and that.
So there are celebrities who are not vets, but they claim to be knowing them more than the vets. I don't want to name them, but that's like an open knowledge. They just write a book saying, I've tried. Hello, where is the research? I could have tried 10 things on myself, it would have worked, but it does not mean one size fits all. But so, there's knowledge. And what are we all qualified for? We also slog for 6 years to become, technical people. And that's where the knowledge has to be transferred to you.
So if we try to break this down for especially the first time pet parents, what are the conditions that we can kind of trifurcate into 3 categories? A, when they need to drop everything and visit the vet. B, when they can wait for about 24 to 36 hours. And C, when they can monitor at home.
Right. So let's start with the first one. If you see blood coming from any of the orifices and the dog is not able to respire. The third, if you see sudden expansion of the abdomen, which is called GDV, it's like a bloat. The stomach begins to bloat and turns around its own axis. These are the conditions that cannot and should not wait. Bleeding, you never know where that's coming from. So it is best to at least put him in an emergency care so that the best can be done. Respiratory problems can be cardiac, or there's something missing somewhere. They become cyanotic, which is blue tongue. He needs to have established airway passage, as we say, that somebody will put him on oxygen. Bloat is a surgery that you should do in first half an hour. Even in half an hour, your chances of pulling the dog out is 2%. So because it takes the spleen along with it and it ruptures. Now, all these things are also preventable, by the way. So that brings us to the first, this thing. The second was, what are the signs that you can wait? Limping, for example, an occasional cough, a one-off vomit. Then you can say, hold back food and water and see what happens. These are the signs that can wait. Third thing is like some itchy conditions, which is the dog is not biting itself, neither it's scratching itself, but you see a mild loss of hair, which is called alopecia. Then you can try some home remedies if you so wish to. With a heavy heart, I say follow Instagram. But, there are some recipes available here and there. You can try that. If it hasn't settled in a few days to a week, please take him to the doctor because it can get worse. And request to everyone all the time, do not presume a diagnosis. You are not an expert. Don't do that. Unfortunately, we live in a system where human beings don't. And so many people go to the doctor with a heart condition. Their only history is gastric aura. So that's not, you're dying, man. You go to a doctor, please tell him you're uncomfortable. Don't start popping in antacids. So the people have to be more aware of what they are looking at. We are more than happy to help people to understand that. That's what I said. I wish we had more pet parents like you, where we will be more than happy to share information and you will be able to maintain a pet way better than you are doing. You're doing an excellent job, by the way. But for other people, you can actually cut off a lot of expenses if you've just understood and sat down with your vet.
I have been talking to a few of my friends and they feel that, I'm just giving a princess treatment to my bro, but it's a daily routine, for a cleaning routine for a dog, whether that's brushing of teeth, brushing of hair, cleaning his paws and genitals when he's back from the walk or she's back from the walk. How important is that?
Very important. I'm a pet parent myself and I do it myself. It does not take more than 5 to 7 minutes of your morning time.
And it's not princess treatment.
Well, don't we do it for ourselves? Then you might as well do it for yourself. Why are you brushing your teeth, cleaning yourself and doing other things? If it's all normal, it's not normal. So most of the diseases also happen, especially in the weather that's just gone by. The people come back from a walk, they haven't bothered, the dog has stepped in stagnant water or muck and everything. He comes back and gingerly cleaning himself. Next day you realize he's vomiting and having loose motions. And that simply could have been avoided if you came home, just washed his feet and cleaned it. That's all it takes. It takes less than a minute per paw.
Yes.
And maybe 30 seconds to clean his butt. That's what you need. And your dog's healthy. You don't have to see vets very often.
Yes. And even brushing of teeth is something that every day.
Absolutely, yes. It's oral hygiene is one of them. What did I say when I first saw him? His oral health is excellent. And because these are the things that you realize, people have not even opened the mouth of their pet. There's a smell aa raha hai sir saans mein se. Have you popped in? Have you seen what's there? There's a 2 millimeters of plaque on every tooth. Oh, inko bhi hota hai. So then there you are.
And that's where you need a vet.
Yeah, that's where you need information as to what I should be looking for if I am looking at a healthy pet and a longer life of the pet. And as I said, except for maybe bleeding, bloat and kabla, many things are preventable. Like you already have an advice of how to make the floors non-slippery. It's a perfect advice. You said carpets, I tell people to put yoga mats. It's got better grip. It's just the same thing. Idea is so that your pet doesn't slip and it doesn't splay his legs because the joints are not meant to be treated the way we treat them. So, and what you're doing is an absolute marvelous job.
And that is why I think regular vet visits are very important.
Yes.
Because they'll often visit the vet only when they'll see things slipping out of their hands. Like the pet is having a seizure, they get panicked, and only then they'll decide to go to the vet. And otherwise, if he's coughing or persistent vomit is actually very common in
That
dogs.
is what I
These are
said.
the
If
common.
any symptom or any excretion, leave blood aside, has lasted more than a couple of times, it's about time. Please take him. You must also be getting these calls. My dog has been vomiting for how long? Almost 2 days. Why are you calling me at 11 at night? Wait till the morning now. You've already waited 2 days. Haven't I? But now I feel it's an emergency.
Oh my God.
So it's an emergency as per their convenience.
Convenience. Yeah. What have you been doing for 2 days? And are we responsible for that? So they don't understand the importance of when to take the dog to the doctor, and like you said, regular vet visits. We unfortunately live in a system where cars are serviced more regularly, as I've always said. Than your health or your pet's health. It's a time for car service, that must go. Oh, dog can wait. It's only a dog.
I was having this conversation before, you guys were having conversation before this. I was like, dude, I've never thought about it. I don't know about the eye precautions that I can take. I've never given bro any eye drops ever. Yes, his ears are cleaned, but how to do that? They're very sensitive areas, balm, paws, and everything that I can take care of. But eyes and ears are very, very, I think it's very sensitive areas.
Yeah, you're a wonderful pet parent, and that's so relevant. Do you even realize that your dog is closest to allergens on earth? He's walking, he's sniffing. If it's a big dog, his sniff is so strong that a lot of dust particles bounce back and they right away get into the eye. So all it needs is just a regular application of lubricant. There are drops, there are gels. You can just do it as a regular habit. Most of us past 50, the ophthalmologist will always tell you that start putting lubricating drops. Your tear production is going down. The same thing happens with dog. For dogs with dropped ears, clinical ear cleaning is mandatory in my opinion once a month. But we teach people how to do it in the house other than when they cannot come to us. And it's no rocket science. You can actually make a video by us doing it, or just see it, observe it, and just do it yourself. And there's absolutely very safe ways to do it without harming the ear canal or causing any other concern.
Because that's something that I'm scared of.
Yeah.
Because I don't
And don't have to be scared of. It's very simple. I'm sure your vet will be able to tell you.
Yeah, he does it for me. Because
It's very important to even make pets habitual to these practices, because I'm sure Bro is a very friendly dog, as we've noticed, but there are very difficult breeds to deal with. So sometimes it's like basic thing of nail clipping or ear cleaning, brushing, which are regular things, and some pet parents they are just not used to it, and the pet is not used to it. So of course it's difficult for the pet parent also. The pet also, he's being exposed to stress, because of course a vet visit is most of the times a stressful event for a pet.
Yeah, you should condition them. That's a very good point. You should always condition them to, like when you get a new puppy, the nails are very sharp. So if you tell them to unsharpen them, just use your filer. It's not only the advantage that you will get out of this, but it's such a good bonding exercise.
Exactly.
नहीं डॉक्टर साहब हमसे नहीं होगा, आप ही काट देना. क्यों नहीं होगा भाई? It's your kid. Do it. Everybody should do it. I mean, if you can't do it, then I'm sorry, you don't deserve to have a dog. हमारा तो माली देखता है, हमारा तो देखता है, वो माली चला गया, ये चला गया, वो sorry, I mean, it is the baby, it's the lifeline of my house, It's how can you say that somebody else will do it? I walk my dog myself every day. Whenever I am in Delhi, nobody else has walked my dog. And there's new culture. So the other thing that you were asking, when people go out they're on their phone, they're not even realizing what the dog is eating off the ground.
Often they put the leash around their neck and the dog is off leash.
Yes.
That's another ruckus actually to the people who walk there, and in fact the street dogs as well.
And then they'll say, नहीं काटेगा. आपको नहीं काटेगा, हमें तो काटेगा. So, that's the thing. This awareness must be brought about. And I really hope that people are, not, of course, they are getting more oriented towards good pet keeping. But there are a lot of matrices that we have to, adjust. So those will happen eventually. I hope so. In our lifetime, maybe, or maybe after our lifetime, but this will happen.
Also, sir, if we talk about pet parents' point of view and you as a practicing doctor, so when a referred case comes to you, so what are the set of things that the pet parent should come prepared with?
So the first thing, which is I always fail to understand that why it is like that. Do you have treatment record? No, the doctor never gave it to us. It's your right. Please take it. Only then will I know if something was done, whether it was right or wrong. So if the problem has persisted despite right treatment, what could be the cause? One cause is either the diagnosis was not correct. Second is, were the medicine administered the way they should have been administered? For example, how do you give tablets? हम तो खाने में डाल देते हैं. ऐसे how much time does your dog take to eat खाना? आधे घंटे में खत्म कर ही देता है. So I said, what happens to the disintegration of the medicine? What if he has left a portion? How much do you know whether he has left? Oh, हाथ से खिलानी पड़ेगी. So, these are just, it's not that they can't do it. They're just so unaware that, so why should we not be putting in the food? So I said, do it. But then make sure the quantum of the food is just like a dessert spoon and he's eaten that. So at least the medicine has gone in correct dosage. It wasn't there's some reason a medicine is packed. It's not hanging from the plants where you can pluck it and give it. So it's packed, it has to be consumed in a certain time. You can't just put it in khana and let the khana be sitting around for 1 hour. So these are the other things. So you have to check that aspect as to what, for example, eye drops. Have you put the eye drops properly, which is if there's an eye problem? If it's an ear problem, have you put the ear drops properly? If it's a skin problem, have you applied the medicine the way it should have been applied? Have you followed the correct protocol? Which one to go first, which one to go second? How long is the gap between two things? So these are the important things that you should first establish. And then if the diagnosis is not in line with what you are thinking it is, your treatment, actually I always say, second opinions are easy to give because the first opinion is not helped. So your mess is one step shorter. You can actually do that. But you have to have a record for that. So that's the other thing. You should and then you go ahead with diagnosis. Try and explain. I always tell people, never go by medical terminology terrorism. Be simple. Let the person understand what is wrong. Don't throw medical terms at them. Just, if you can correlate with a human example as to what we go through, it's easier for them to correlate and understand. And then you go forward from that point. But carrying medical record and answering the question. When I say questions, I always say ask your questions from the tip of the nose to the tip of the tail. Starting from breath, have you peeped in the mouth to see if there's a tartar buildup? Have you checked if the ears are bad? Is the respiration all right? You go backwards. Is he peeing all right? Has there been a change in the color of the pee? Is he finding it difficult to pee? Is he pooping all right? Any change in her diet? What kind of medicine is he on? If he's taking some vitamins, these things change color and consistency of poop and also the color of urine. So at least you don't begin to diagnose downwards. That if it's yellow urine, maybe he's taking a B complex. If the poop is black, it's not necessarily bleeding. He may be taking iron supplements or a food that is of that color. People who feed beetroot and a large quantity of fresh meat. This can happen. These are normal things to happen. So, this is where these things, ask your question, even if the pet parent has to come back in 1 or 2 days after observations of these things. Also, we also encourage to share videos, especially if it is of, let's say, gait issues where he's not able to walk. You feel the pet is breathing not correct. The best way is to take a video when the pet is sleeping. So if there's a breathing issue, even when the pet is sleeping, there'll be an issue. So you can make that out if the person is reading it correct. About the vomit, whether it's regurgitation or it's actually a vomit. It's perfectly fine for canines to eat up their own vomitus. It's normal. There's nothing wrong with it. But we feel no, it's not good. If it's a regurgitation, the pet is going to eat it back and allow him to eat it back. There's nothing wrong with it. So these are very important things again. If you cannot explain, at least take a video. You would have heard of cochlear vestibular syndrome and the eyes are going like Oscar in the eyes is going right and left. People get scared. It's nothing really to be worried about. It's a simple thing to treat. So don't panic. Yeah, seizures is one point I missed, that when you should be taking your dog to the vet. Seizure is another thing that should be taking your dog to the vet. Accident, if the dog has fallen. These are the points where Coming back to your first part of the question.
The eye trauma.
Yeah,
also.
yeah. Any kind of trauma, you should rush to the vet and see how to stabilize it. So these symptoms, coming back to the second opinion, have you or were you able to explain the symptoms correctly? Was the communication good enough?
And it's also important that the person who actually takes care of the feeding and takes the dog for the walks, it's important for that person to actually accompany to the vet, because oftentimes the pet parent comes but they have no idea whether the pet has vomited or did even pass the stool today in the morning or not, what was the color and all these points. So they're often calling the caretaker or the house help at home.
Absolutely, yeah.
Yeah, so
That's
there's a
very
lag
valid.
actually.
Yeah. Also, sorry to interject, but there are problems that a pet gets in different seasons. Yes. So if you have a regular file, you can always check that in summers he's prone to this problem, in winters he's prone to this problem. Is this, problem season specific? It makes life easy for all of us.
It makes life easy for everyone. I mean,
Exactly.
again, the people think that it is very expensive to keep a pet. Please, if you keep these things, basics clear, na, pet is not expensive. It is just a clear basics. Where I think the pets are the best kids to have these days in this very expensive world.
Considering you don't get admissions in Delhi schools any which ways now.
Yes, exactly.
And if you don't belong to Delhi to a good school, you won't get admission.
So,
Might as well have a pet.
So keep your basics. I think that if you keep your basics clear, na, your pets are not expensive. Then you are just doing you buy stuff.
Don't do it as a formality. Do it as your child. I always tell people. Yeah.
So I think it's very important that a pet parent, it's his duty to run your fingers through his body daily, because only that way you'll come across if any bump is there. That can be a tumor in future, you never know. Or if a tick is there and that tick you have actually encountered for the first time.
Yes.
So that tick you can actually show to the vet potential harm that a
Tick
tick
paralysis.
can
We had a
can
case
do.
that this dog was being treated for paralysis and there was a tick hanging in there. I said, go remove this tick and give some neurotonics, your dog will be fine. And he was fine.
Yeah.
So it's just as simple as that.
And they often say, oh, it's just one tick. How can one tick cause tick fever?
They should go I don't remember the movie, the Nana Patekar movie. Ek machhar bhi aadmi ko dash.
Yes.
It's not that. It's also about limping, we say. All limpings are not orthopedics. It could be neurological. It could be muscular. So don't go downwards, as I always say. Do that exam. हमारे पास बहुत लोग आते हैं, सर इसकी ना टांग खराब है, तो डॉग चल नहीं रहा ठीक से, तो हड्डी में तकलीफ है.
And often they do not even bring the pet to the clinic and they just come with this statement that the pet is just limping, please koi medicine de do.
Yeah,
Are
so
you
don't,
serious?
Oh yeah.
If we can actually summarize the questions that pet parents have on the first visit to because when they get a puppy, he's actually about 45 days of age. So what we should, the points that we should actually tell them, that these are the points that you should take care.
There aren't very many. Couple of them are, make them understand that the puppy is going to pee every time he gets up from the sleep within 1 minute. There is no way around it.
And after having meals also.
Yeah, so don't get perturbed that he's peeing too much. They'll come back, oh, doctor, he's not stopping, he's like a waterfall. He's expected to be. He's growing up. There will be accidents when he's excited. Small. The bladder is small. The nervous control is poor. All this grows over a period of time. So first thing that. Second, a puppy can sleep up to 18 to 20 hours a day. Don't please see that your puppy is lazy. That's a part and requirement of proper mental and physical and neurological growth. It's absolutely acceptable. The longer he sleeps, the better he is. Don't wake him up to play. Only wake him up when it's meal time. Try and tell people, I always say that do not take your puppy out until he's vaccinated against distemper parvo especially, because these diseases have a very poor success rate despite best treatments that you can give. So keep him indoors. That's the best advice that I would give them. Do not expose them as soon as you get a pet to very cold environments. People just neglect that because they don't realize that either the puppy has come from a litter where they all cuddle up together, they get warmth from each other, or they are cuddling up to the mother where the mother is keeping them warm. They come in very luxurious rooms. The puppy is exposed to air conditioning. The next day morning, the complaint is he's vomiting, he's got loose motion. This has happened because you have changed the environment a bit too quickly. Don't bathe the puppy. Don't get used. इसमें से smell आती है. It's not the smell. It's the sebum that they secrete, which smells different. So, as I said, do an analogy. Tell them that you buy a new car, you have fabric smell, you have plastic smell, you get used to that, right? So, you will get used to the smell of the...
Yes, and like you said, sir, parvo distemper, these are actually very potential lethal diseases in puppies. So also making sure that they're away from shoes and slippers because they are a source of carriers.
Yes, exactly. These are and drain traps. A puppy is going to explore his world. And anywhere he feels good smells are coming from, which is good for him, not for us. He's inquisitive. He is only going to lick it. God hasn't given him a thumb to pick up and see. He is going to lick it and he's going to fall sick. So the advice that you give to the first-time pet parent or a new puppy adoption is allow him to sleep as much as he does. Expect him to pee maybe 50 times a day. Please take him out to poop after every meal. Don't unnecessarily wet the pet in terms of bathing him. Just use a dry shampoo, as you rightly say, or just a white tooth comb is good enough to keep the circulation on the skin going. Go home and lie down on the floor and see all that you can see, because that's what your puppy is seeing. He's
Right.
not at 5 feet or 6 feet to see, where you are.
Yes.
So these are his target
Corners,
points.
yes,
He
and
will
they
go
need
to
something
places where you can't go. So explore those areas, buy a good vacuum cleaner, suck out the muck. So, so those are the things that are important when you get a puppy. What is the counseling all about? The counseling is all about this. Then, of course, the food. That how is human food not fit for them?
So, of course, the pet parents know of the vaccination of dogs. In fact, the breeders also sell the pet off that you have to go to the vet and get the pet vaccinated. But in case of cats, if the cat is doing well, they don't think that they have to visit.
As long as she's doing well or he's doing well.
Yes, as long as they're doing well. But the vaccination point that even I tell the pet parents very much that जो पैसा आप vaccination ना करके बचा रहे हो, you'll have to pay 2x, 3x or probably even more in the treatment part.
Yeah.
And that time, whether the survival of that cat would be there or not, that is a big question mark.
Absolutely, you're bang on, because the reason for this is, one, you don't have a good history. Cats are very shy pets. So you'll never be able to observe beyond the basics. Limping, you may be able to observe. A little bit of vomiting, you may be able to observe. And then you'll say, oh, the hairball hai, isliye karta hai. And then you have urinary obstruction and poop. There are only 4 signs, because most of the time the cat is hiding. So you don't really have a good this thing. Plus, they behave very differently in the clinic. And you can never read or palpate or understand a cat. If you're using a stethoscope, they are hissing all the time. You're not able to pick up the sounds. If you want to palpate them, they are ready to bite you. So, cats that way are, yes, they are picking up. The other issue as of now is that we have lack of diagnosis. We do not have all the vaccines available. And as you rightly said in the first instance, people are not even aware the cats need vaccination. The third thing that I want to add to this is deworming. Fleas are natural carriers of tapeworms. And tapeworms, if affects human beings, can create havoc. Nobody is aware. And the medicine is not available. You cannot pill a cat easily. It's a failure in most instances. So you have to give an injection. And it's a super expensive injection, but it is worth the money. So which is the reason in cats. But yes, they are picking up in number. We at least have 20% cats as pet. People have cats as pets, about 20% of them.
And now after Corona, there has been a spike in the cat as pets in the household.
Yeah, because your demand is much less, because
Yes,
it's a self-groomer. You don't have to give them meals. You can put out the food. You're absolutely right, yeah. But yes, when it comes to treating them or taking history of them, it is, as you rightly say, is a challenge, because people are not aware of vaccinations, dewormings and things like that. Plus also history. Where does the cat come from? A multi-cat household has viruses which are just floating around all the time. Peritonitis, leukemia. We don't even have vaccines for this. And, by the time the cat is presented, They are showing different signs. They are so mysterious. So, you don't have same symptoms for the same disease in all cats. So that becomes a challenge. But well, they're picking up. There are more conscious breeders now coming in. People still give them doodh and roti. That's not a meal for cats. But yeah,
They're obligate carnivores, and some communities, they hesitate in giving meat actually to the cat.
Well, Navratras are coming. There are enough people who hesitate giving meat to their dogs. So, Doctor Sahab, Navratri aa rahe hain, to hum meat to khayega nahi.
But this is still, dogs can also, for for an ephemeral phase, they can still survive on a vegetarian diet. But a cat is a obligate carnivore. Their taurine fulfillment would actually only be fulfilled by the diet that we give it. And I've seen actually very bizarre instances that people actually feed Maggi, tea, sweets, and just plain carbohydrates to cats. And they're like, they're just doing fine and not even caring to vaccinate, forget like vaccination when they're giving this diet. So, and especially when they come to us at a certain stage with a certain temperature, like 92°F, and then they expect that cat to actually get well from that 92°F. I mean, that's
We had
unless
a
and
case
until a
like that
miracle.
just recently. This just cat walked in fully comatose, lack of history for us because they didn't know for the 5 days. He said, thoda kam kha rahi thi. There was hardly, I had to do a jugular puncture. Where else will I get the blood from? I can only give sub-Q, and jugular punctures can be very dicey with cats. Picking up, let's hope that there are more breeders, there are more people who are aware of this, there are more people who understand vaccination. There are times when vaccines are in short supply because they don't sell enough. The companies are working on volume sales. They are not working on emotional angle. That, some cats need it even if we waste. No, they want a certain amount of sale, which is when it will be available. Like the pet dewormer. Droncit injection isn't available. So, these are the challenges that we as doctors face, and I'm sure you're also going through this. But hopefully things will get better.
I hope that pet parents get aware of at least the basic vaccination and deworming, and it's a way that they will at least visit the vet. And when they visit the vet, of course, the weight gets monitored, their queries get solved, and feeding schedule, how much to feed, what to feed at a certain age. But these are the things that you'll only get to know once you actually start visiting the vet and also taking their advice seriously. Sometimes they just often overlook the vet's advice that doctor ne bola hai meetha nahi dena, but what to do? It just comes up when we're snacking with a puppy face, and if I don't give, then at least my grandfather or somebody elderly in the home they give, and that's the cause of dogs actually getting overweight. And an obese dog can actually carry so many problems.
Yeah. Obesity by itself makes them prone to, there's a research, you should read about that, are prone to lymphomas. Just because they're overweight. They are prone to diabetes. They are prone to heart conditions. Osteoarthritis is a blind man diagnosis for them. So, there is so much, why you should be a little unkind to be kind.
Right.
This is something you should learn. Food is not the only expression of love.
And when the pet gets overweight, then the expense would also increase with the weight.
Absolutely.
Medicines
Everything
goes as per the dog's body
and
weight.
good supplements are expensive. They aren't cheap. Yeah, and which you could actually genuinely avoid. You must discuss always, the first thing you must discuss is my dog's weight correct? Do I need to adjust his diet? Shall it be on the right side, on the left side, or I am on the right path? These are just very, very simple observations. Rather than getting into detail of an hourglass figure and look at from top, look at from bottom. It's simple. You can see your dog is making an effort. So the most of the people, I'm sure, they tell you, Doctor Sahib, isse bhi mote dog dekhe humne. What answer do you want to give them?
And they say that we like our pet this way. We like him chubby. And when he's lost a little, like 2 to 3 kgs, we don't like him now. Means ab wo patla ho gaya, ab hame aisa acha nahi lagta.
See, when Bro came to me, Bro was an aggressive dog, very aggressive dog, okay? Now he is not, like you can see here. It took me 6 months. I quit my job. I trained him. Everyone asked me in 15 days when I adopted him, it was like, Alankita, let's give him up. He is very aggressive. We will not be able to take care of him. I said, had I delivered a normal child, would have you said the same thing? No, na? So give me some time. Give me at least 6 months, because this is my first dog. Give me 6 months. And trust me, those 6 months, every YouTube channel, vet, of course, books, everywhere, how to get the behavior right of a dog. I did everything. And I ensured that this dog gets so calm that today, so many people around, he doesn't bark. He knows when to bark. He knows what to say, when to say. He knows my tone so much. It takes a lot of commitment. Like, जब बच्चे को पैदा करते हो ना, तब आप commit करते हो ना कि मैं इस बच्चे का बहुत ध्यान रखने वाला हूँ या रखने वाली हूँ as a mother, as a father. It's the same commitment you need for a pet baby as well, whether it's a cat or a dog. जब डांटना है डांटो, जब उसको रोकना है रोको. Please play with them. Please play with them.
Yeah.
It is very important that mental stimulation is so important. No matter half an hour if you give out of your life ना कि हाँ मैं आधा घंटा इसके साथ भागूंगी या भागूंगा, just play fetch with them.
It's good for your health also.
Exactly. I have lost a lot of weight because of him. क्योंकि मैं ब्रो के साथ बहुत भागती हूँ. Like I take him to the park and I'll start running with him. कि भागो 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 भागो. Or else if not take him to the park, I'll go to the terrace. And like चलो bro भागो 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 मम्मी के पीछे भागो, and then I'll play hide and seek. Half an hour, 45 minutes I think maximum I give him during the weekdays because I'm busy. But those 45 minutes are for him, and he knows it starts at 10:30. That's 11:15. Mummy is gonna home by 10:30. I'm gonna go upstairs. She's gonna play with me. फिर हम आएंगे, फिर हम dinner साथ में लेंगे, and then that's the day how we end the day. Yes, I can't take him for the walk. I have a dog walker for that, but I ensure that mental stimulation of my pet happens, because the entire day he should not feel bored.
They also say, and this overweight thing, it's not about body shaming. It's not about health.
It's about the health.
People just, this new generation, they freak out about this. Oh, don't body shame my dog. He's just fat, blah, blah, blah. So once I actually made a statement, which I don't know if I was right or wrong. I said most overweight dogs have overweight pet parents. Oh,
True.
It was like, man, what are you talking? And I said, please don't. It's just health. I'm not trying to body shame anyone. I am not the fittest person on earth. I know I'm slightly overweight or not morbidly overweight, but I admit it. I'm not challenging it in the open. That is wrong, and don't body shame me. And take it as a healthy advice. It'll be good for you. When your doctor tells you this, then it becomes correct. But if somebody else who's not your direct doctor says this, then it's body shaming.
It's not body shaming. It's the health. It's health at stake. It's obesity, whether it's human or pet, your health is at stake for sure. So don't think your body shaming nahi hai. It's a very healthy advice, and please ensure that you give the right. कभी कभी पता ही नहीं होता ना. Like we don't know wheat is never good for your dogs. We don't know that.
And in fact, one thing that pet parents are, especially cat pet parents, most of them I'm sure they are, but some of them, they don't have this knowledge that cats actually are the cleanest creatures and they don't need bathing often. Sometimes actually cats rarely need a bath unless and until it's really dirty, because they keep on cleaning themselves. They have such a flexible body, they can take their tongues all over their body.
For dogs. But it's just bathing and the grooming scent. I see Labradors that are shaved like complete bare.
Yes.
Why do you do that?
Double
So you
coated
have
dog
to
should never be
explain
shaved.
them that
Yes.
hair serves as a protection. You are exposing your pet to more problems.
Yes, they are there for a purpose.
Again, a simple example. Sikhs don't get heat stroke because they've got turban on their head. Some in places like desert areas tie a turban on their head because the heat should not be absorbed. Here, because it's summer, there are grooming parlors. Shave them off. And suddenly they have that MF Hussain look, which is only the tail has a little bit of brush and everything else is gone.
Lion tail.
No, I call it MF Hussain. I want to tell people that it is wrong. And why do they do this? I can't understand. Nature, you cannot go against nature. I say, why don't you shave your head? It's hot for you too.
And over grooming is also something that should be avoided. Just because some pet parents cannot tolerate the stench of a dog, they're like, let's bathe him almost every day. And to make the conditions even worse, they use human shampoos. They're like silk shampoo, sunsilk se nala dete hain. Like literally, can you imagine? this practice is definitely there in the rural areas, I guess, like back the time when I was studying. But some people even now do it after so much of exposure and social media awareness. Even now they do it just to save couple of bucks, or I don't know, out of like no knowledge, no
I think
awareness.
people think that spending on dogs is
also, yeah, you're
rich
right.
How much
man's.
would a shampoo cost?
So even if it costs that much, it's like saying I'm complaining about buying a Mercedes because it gives me less mileage. Don't go buy it, no?
Exactly. A pet does come with some
It
basic
does.
cost.
It's an expense. It's a huge
A
expense.
baby
Admit
comes
it.
with a lot of expenses. If you consider your pet as a baby, then please, your baby also comes with a lot of expenses. It's not just usko paida kar diya to khatam. Diaper comes, education comes. There's so many things. So if your pet also, you've welcomed a pet in your life, all the expenses that comes along,
And the pet will keep loving you. Won't complain.
won't complain. उसको आईफोन नहीं चाहिए होगा.
Yeah.
iPhone
Not
18
the latest one.
Plus बोलेगा. I don't need. And trust me, even basic dog shampoo is enough for your dog. You don't have to be fancy about it. I'm sure that that's something that you guys.
Exactly. This is, just get to the right product, do it the right way is all it takes. But yes, it is expensive to keep a pet because you are dependent, you don't know what's wrong. So you've got to go to your doctor and he is going to charge you, which I think as a doctor, I advocate all of us should. We are all in the world for commercial interests. Nobody works for free. So
But I'm sure it will not cost a quarterly fee of 1 lakh rupees in school.
yeah, exactly. Plus, also whether he'll turn out to be a good graduate or not. So, that is absolutely fine. And, if people do come and ask, how much does it cost to keep a pet? I say 15 to 20,000 rupees a month. Oh, it can't be that much. I say, calculate. खाना खिलाओगे, उसको घुमाओगे, घुमाने वाला रखोगे, नलाओगे, grooming के लिए जाओगे. I changed my hair from barber to a hairdresser because my dog went to a salon. He gets his haircut for $1,000. I'm using a barber for 100 rupees. So I changed to a salon. I go to a good salon now. And he's a hairy small dog, which is why I'm anti-bathing pets. We always say you're bathing him for your convenience, not for his requirement.
Yeah.
And the next day onward, either he's dirty because he's gone and rolled himself in the mud, or he's smelling the same because they don't understand that their sebum has a different smell. It is just a new smell. Get used to it. But they keep washing them, like she said, they'll overbathe them. They will clip off the hair. They will use dog perfumes. I mean, who has done the research on dog perfumes? Yeah? What is dog perfumes all about? So that's the whole thing. And today, I'm surprised that there's so much of information available. You cannot go wrong. It's simple. Even the manufacturers, the end users, there's so much available. I mean, if you are going wrong, then there's something wrong with you.
And that is why I think we are doing this podcast, even if that information is not sufficient to, reach people and they're still not consuming that or at least adhering to it. People should at least have basic knowledge and basic, the do's and don'ts.
But according to you, how a dog grooming is concerned, the duration of bath, we have dry shampoos for dogs. How much should we use it? Because like you said, over grooming is also a problem. So if I have, what should be my routine for giving a bro a bath? What should be my routine when it comes to dry brushing or using a dry shampoo, brushing the dog every day? What's the routine that we can follow, or how we can take care of it?
Brushing should be every day, at least 10 minutes, I would say, and at least twice a day. First, it should be from tail towards head and then from head towards tail.
Bang on.
And second thing, bathing should be as minimal as possible because dogs have sebum. There are natural oils in their body, and over grooming them actually can rip off those oils, and we are making condition worse from them, making them prone to some conditions like Seborrhea sicca. Okay, maybe dandruff you can say in the dogs which are being overgroomed. And dry shampoo, of course, you can use it between their baths. Like if you have given a bath, suppose 3 to 4 days back, so don't just try giving a bath today. Maybe if he's slightly dirty, his paws are dirty because he just went, into the park or something like that, then just dry shampoo it only in the areas which is required. Wipe them off with the tissues, the wet wipes, and I think that's it. And in winters, the frequency can even be further reduced. the bathing. So it can be, if you talk like in, please tell me if I'm right, sir. In summers, I think it should be every 15 days. And winters, it can be even a month also, once a month.
Bang on, absolutely. The lesser you bathe them, the better it is, period. We do it because our dog is on the bed, he's sleeping with me, so we just want that all the muck is gone. It's not medically required. I'm a doctor myself. But we do it, we are careful of the shampoo we are using. That is the gentlest on the skin. It does not cause any dry skin. We make sure he's at least groomed once a day, so all those circulation and oils are back. And that's what is really important. Otherwise, and so every dog has a, he'll go into shrubs and things like that. He gets dirty. So, that's why we do it. I mean, he doesn't care what it costs. He'll just, in the next 5 minutes, he's again dirty.
They love going there,
Yes,
actually
yeah.
getting dirty.
Yeah, so that's...
But will you both agree that if we brush our dog, like you said, twice a day, that smell of sebum also goes away?
Yes, it becomes better because it's not concentrated. It's like when we sweat excessive and if you take a shower or you just mop yourself, you're fine.
Yes.
So it's just not sicked in there. So what she said is absolutely correct. 1 stroke against the hair, tail towards head, and 5 strokes in the direction of head towards tail. Do 10 sets. It's virtually 10 minutes morning, 10 minutes evening.
Yes. Okay. I think in that process you also get to know if there's any bumps or anything.
Or any ticks,
Exactly.
or any knots also, because in Shih Tzus and long breed dogs, in Maltese, etc., they're actually, once you get mats on the skin, then it's very difficult, and sometimes you have to actually shave them off because you cannot
Because
actually...
you're not groomed them. The sebum is so sticky that it causes matting.
And does it apply to the cats as well? Like
Cats are
of course-
self-groomers. They are naturally so clean. I'm yet to see a dirty cat. A healthy dirty cat, no. Sorry. Even if you see a feral cat, they are all clean. You'll never see a dirty cat.
True that.
They're so hygienic. They, it's like monkeys. They never see a dead monkey on the road.
Oh my God.
And actually, another point of calming a pet regularly is it increases the blood circulation, and all the hair that you'll see now shedding throughout the day, that will actually come in the comb, and that way you'll see less hair around
That
the hair.
I've noticed, like since
There are people who give supplements to stop shedding. Until it's medical shedding, you don't need it. So shedding is also based upon exposure of the pet to the light. Now you live in apartments now, so the dog is continuously exposed to light. So the brain or the mechanism by which they maintain their hair density is actually all flawed a bit now. So which is why shedding has become excessive. So technically, when it's summer, there's more sunlight, so the coat is thin. But when the dog is always in the bright rooms, so the trigger is still to shed. So we simply say, go, at least I recommend that, comb or groom your dog outside the rooms. Do it in balcony, driveway or wherever. And then you get your dog back in, you will never see shedding. And it actually is 80% of the cure.
But that brings me to the next question of mine, that how important are supplements, and should the supplements be given without, like, we take supplements at times, humans also, कि आजकल glutathione का एक supplement आ गया, let's take it, right? For even dogs, can we go for any supplement that's available in the market without vet's permission?
Please don't do it for yourself. Also, don't do it for your dog. They're both not correct. It is, nobody knows what glutathione is because it's a recent discovery. Everybody thinks I'll be 15 years younger if I take it for 15 days. It doesn't work like that. So I always say live healthy. That's the whole thing. So if coming back to your question, if your pet is in good body weight range, you don't really need to be very aggressive with vitamin therapy. Yes, owing to modern living conditions where you have slippery floors, stairs, and less space to run around, the joints haven't moved as they should, then you may need it. But when you need it, it should be under doctor's supervision. And one thing I would like to advise through this program or the podcast is, don't use pain meds freely. 50% of the dog population die of unexplained renal failures. We don't know why it happens. It's called idiopathic renal failure. The other 50, out of that, 80% die of indiscreet use of painkillers. Painkillers are very harsh on kidneys for dogs. And human painkillers can kill your dog in 3 doses, like Combiflam and this Vovirans and things like that. they will knock your dog off in like 3 days.
One paracetamol can actually kill a cat in just one dose.
Yeah, one dose.
What?
Yeah.
Okay.
So, these little things people should be aware of.
But even vets advise, like, half of, like, even when when bro was sneezing or something, like, adha crocin.
Yeah. So, dogs can tolerate it.
Okay.
Dogs can tolerate it at a certain dose.
अच्छा अपने आप से मत दो मेडिसिन एक बार वेट से पूछ लो
Cats
No,
के लिए it is
yeah, cats के लिए तो it's poison.
Oh.
Yeah. So, these are the things that you have to be aware of.
Right. And I think one topic which often goes overlooked in dogs, that is food allergy. So let's talk about that also a little bit.
So there are many conditions that we'll come across which we keep thinking is a primary symptom is the disease, but it is not. It's the food. So food allergy is like a very, very big thing, and your pet may be allergic to the thing that you think he's not to. So always good to understand there are various signs: excessive licking, excessive shaking, rubbing its body against furniture, carpets and things like that, trying to go for anal glands, repeatedly scooting is not necessarily an anal gland problem. I mean, if a neutered pet is doing it because it's hormonal, you would know that. If it is hormonal, you can still say it and wait and watch. But if it is just happening every day, please look into the food. And then you can do an elimination trial, or you can simply use an hypoallergenic food. Both are good. When you look at a home trial, remove one major ingredient at one time. For example, it could be chicken, it could be mutton, it could be some form of carbohydrates. And then you can eliminate that, see if there's an improvement. If there is, you are close to a diagnosis. If not, put the dog on hypoallergenic food, which is commercial. And then after 6 months of that, provided he's done better and there are no endocrine issues which are causing these concerns, then you challenge the diet. Then you start adding an ingredient every day, because you don't want your dog to live on a hypoallergenic diet forever. So the moment you add a new ingredient, if he does not reverse back to his original signs of disease, then you're good with that ingredient. Go to the second ingredient, third ingredient, and eventually you will hit the hammer on the head of the nail. It's not difficult, it's cumbersome. Coming back to have patience, you will reach the conclusion. You can't straight away say this is the allergy. So there are people who are allergic to anti-allergy medicine. What do? This is one of those things. So yeah, that's very important, and people must be made aware that all home cooked food is not correct for the dog. You could be going wrong somewhere, and it's not harmful in any way or discouraging in any way to discuss the same problem with your veterinarian. He will be able to guide you through this, as we are doing on this podcast, that that could be elimination trials, or replace the food and then challenge the food after 6 months, because that's the minimum where the time gap they say is required for the body to settle in, and then the proteins that are responsible for causing these changes will settle out, and then you start to do that. So yeah, that's a good point, and people must know that this can be a thing.
I think I can validate this with a case study of my own bro. So one winter I could see that, bro starts having rashes, okay, and there are boils on his body. It happened and I was like, okay, fine, there's something wrong with him. And we did not even check about what he's eating or whatever. He was given the same food that he's eating. It's just that we added, since it was winters, we added eggs to it. One winter passed, I was like, okay, fine, maybe something has happened, and then it slowly and naturally went away. Second winter, again this happened. So in that second winter itself, I took him to the doctor and I said, Doc, there's some issue with bro. Every winter, like last winter also it happened, it's happening this winter also. It's like, what are the food changes you're doing, Alankrita? I said, I'm just adding eggs because it's winters and dogs are supposed to eat eggs. He's like, how many eggs are you giving? I'm like, 2 eggs. And he's like, whole egg? I said, yeah, whole egg. He's like, Alankrita, before I put him on the medication, trust me, this is a doctor's advice. Before I put him on the medication, eliminate eggs from his food. And let's see for next 5 days what happens. Trust me, dogs, both. I'm like, in 5 days, bro's rashes were no more there. Boils, all settled. And I called up my doctor and I was like, Doctor, there's no more rashes, no more boils on his body. He's like, that means bro is allergic to eggs. Now, dogs do eat eggs, but my bro is allergic to it.
Exactly, which is why I said we need more pet parents like you. These should be observant. People will say, regular khata. घर का खाता है भाई, घर के खाने में क्या खाता है जो हम खाते हैं? Hello? I mean, come on, you don't make him sit on your dining table. Tell me what he's eating specifically. So, that's so important to know. And also, this gets me to one unsolicited advice here. Do not give egg yolks to dog past middle age. Because egg yolks are very rich in phosphorus, and phosphorus is bad for kidneys. It's nothing to do with cholesterol. Cholesterol, until you have an endocrine issue, is a self-limiting condition in dogs. No dog dies of hypercholesteremia, but yolks can absolutely damage kidneys. So beyond middle age, don't give yolks. And for beagles, no yolks forever.
Wow.
You're a very, very good pet parent. You can take that as a compliment.
Thank you so much.
No, life is beyond love. Life is beyond, you have to understand what he needs, how much he needs, what is correct, what is incorrect. Love at first sight is all very well said and done, but what beyond that? You have to live with each other. Yeah.
Because I think anybody can be a pet parent, but being a responsible pet parent is what is actually needed for the pet. So I think we had a very valuable conversation with the doctor, of course, and also you as a pet parent, because I'm sure many pet parents who are listening to this podcast now, they would get insights. Okay, this is how Miss Alankrita did, and this is how even we should do it for the betterment of our pet. So just to summarize, just whatever we taught, whatever we talked in this conversation, that I think vet visits are very crucial. Not just after you get a pet, but also before you even decide to have a pet at your home, because there's so many factors that you have to consider, and it's a commitment of at least 10 to 15 years, if not less. Second thing, regular vet visits are very, very important. If your pet is facing any issue, then that's very important that you take a photo or record a short clip, especially in cases of seizures or coughing or limping or anything
Respiratory
actually.
distress,
Respiratory distress.
excessive shaking of head.
Yes.
Yeah, sometimes that's a seizure.
Exactly.
Yeah, and you find nothing. He's just shaking his head, and you say, "Oh, he's just shaking his head." Yeah.
And those things are actually not possible to to explain to the vet at that moment. So whenever you visit, also go with the set of questions like we discussed, and also carry the file of what was the treatment prescribed earlier, was the treatment successful or not, and what were the tests that done at that time. If possible, please carry the printouts of it, not in the phone, because of course how will the doctor do his or her job better. And third thing, grooming is a very important part, because of course we all want our pets to be clean, but when to do it, what shampoo to use, how often to do it, these factors are also very, very crucial. And of course, vaccination, deworming, if you want your pets to be healthy, vaccination, deworming are the basic stones, like the basic points in that.
Cornerstone of good
Cornerstones
health.
in that, absolutely.
I think
don't,
above all,
yeah.
we need to be very observant about that. I think as a pet parent, I can this message to all the pet parents: please be observant about your pet. How he or she is behaving can tell you volumes about what they want or how they are dealing. So be observant. I think just take care of them. They're just
And don't presume diagnosis. Ye to hota hai. It doesn't work like that. We have had renal failures at 3 years of age. The dog, हमने सोचा सर्दी है, गर्मी है, इसलिए नहीं खा रहा. हमने ये सोचा. Hey, come on, yeah, just take your dog. It's one simple test. It will just tell you where you are. And so the other thing is, why is it that these signs get missed? Is because one, the dog hides it. So any subject in life that is capable of being a prey will protect itself from predators. So then this disease is never seen early. But when you do regular checkups, it is always caught early. So don't wait for symptoms to come in, because by the time the symptoms come in, 85% of the damage is done. 85%. That's how much they can hide.
So thank you so much, sir. I think
No,
even
it's
this
been a pleasure.
conversation,
Yeah.
I have learned so many new things from doctor. So thank you
That's
lots.
all
Your
good grey hair. So
experience
you
speaks
will all
volumes.
be there in some time. So and thank you, ma'am. I'm very, very impressed with the level of pet parenting that you are doing. I hope there are more pet parents like you. It will be fun time and good time for the pets that people will adopt. And yeah, keep it up. You're
Thank you so
fantastic.
much.
Absolutely, kudos to you.
Really fantastic. And before we started, I'm very, very impressed. I'm repeating that.
Thank you so much.
I hope all the pet parents are actually as responsible as you are.
I hope after listening to this, they do become one.
And they understand that it's not a dog after all. It's a life.
Not a dog. Thank you so much.
Okay,
Thank you.
thank you.